Hi everyone, my name's Courtney. I am a product manager here at Global Health, and today we are going to be doing a webinar on HotHealth, which is essentially your digital doorway to healthcare services.
So today we're going to be going over a few different things. So firstly, the importance of an online presence, how patient engagement works into that, and how that's important these days as well for not just for healthcare businesses, but for a lot of businesses. And then finally, how a tool like HotHealth can help digitize the process for online forms, online bookings, video appointments, and then if we have time, I'll also touch on a couple of Global Health's other products that can help with modernising the process for client records and the secure transfer of health information. If you do have any questions, feel free to type them into the chat. You should all be able to do so. Otherwise, you all have my email addresses. You can follow me up afterwards as well if you wanted to organise a further time to chat about HotHealth and how it might work for your business. So firstly, online presence. An online presence these days is so important for all businesses, not just for healthcare ones. And I think one thing I want to point out is that HotHealth can be used in a variety of different ways. So for organisations that don't have a website, it can be used as a website. It's mobile responsive, it's got a clean layout, it's easy for patients or users to navigate around, and it's got your normal, it can have your normal website functions. So your home page, your contact page, where to find you, and blog information as well. On the other hand, if you are an organisation that already has a website, you can use HotHealth in parallel to that. So you can just use that as essentially your engagement platform. You can link from your website to your HotHealth and then from your HotHealth back to your website. One thing with HotHealth is that, we believe in your business having consistency across all your touch points, whether that's physical touch points like a bricks and mortar clinic, or your online touch points as well. So website, engagement, online booking, social media, and so on. So I'm just going to show you a couple of different demo versions we have of HotHealth, just to show you how different the branding is, so you can kind of visualize it for your own. So here is one we've got for an allied health business. You can see they've picked their own colours, their logo, what options are available across the top navigation bar. They can add an announcement bar with any, important information for patients to see. And then down here, they can also customize what their call to actions are. So book online and email us. And they can outline everything that they do, and also the Google Maps integration. It's all customizable from other links you add in there as well, so you can add some social media links and so forth. If I flick over to our specialist demo one now, you can see that the colours have completely changed. So the layout is still the same, that really easy to read layout from a patient or user perspective, but the colours and the branding and the imagery are really different. So their announcement bar is different. You can actually get rid of this bar altogether. They've got different options across the top, and then their call to actions are different as well. So they have call us instead of email us. You can remove book online altogether if you're not using the online bookings function. And they also don't have that services block here that I outlined as well. So you can remove parts that you need based on what your needs are for the organisation. So that's the difference in kind of the branding and being consistent across your touch points there. So next we're going to go on to patient engagement. So it's really important to continue the engagement after consultations occur, and I think this has become really apparent as well since COVID-19, with people not being able to come in as often as they might like, and we have to kind of take that engagement online. So historically, we've always communicated with our patients, might have just been in a different way. So posters, newsletters, more recently websites and social media. You need all these types of communication online, and your clients want to access them online as well. So HotHealth can help in a variety of different ways. So I'm just going to show you these here. So the first way is news. So news essentially is like an online blog. I'm just going to edit this one. So we can add in a title and a body. You can attach some videos, photos, or PDFs. And then the next bit is kind of something that's a bit unique to HotHealth. We can either have it viewable by public, so if you're just trying to establish some credibility in the industry or in your area and you just want to have some information publicly available to anyone that visits the website, you would tick public. Otherwise, if you are distributing information to paying customers or people that have a specific condition, you can choose a specific group that you want to publish that information to, or groups if there's more than one. When you publish this information, a notification will actually be sent via push notification if they're on the mobile app, or via email as well if they don't have the mobile app, and just let them know that there's a new piece of information online that they should check out. So we can see here, that's that one we've just done, that you can embed videos in there if needed. And if I was not logged in to my account, I actually wouldn't be able to see that video there. Events kind of follows the same vein in terms of you can have it publicly available or accessible to only certain groups. So this one here, we have publicly available. Again, you can send notifications, so that engagement communication piece. And for events as well, we can ask for responses, so you can use it to manage your RSVPs. So users can click whether they're attending or not if they're logged in. And then as a manager of the site, I can see who has RSVP'd, yes, maybe, or not going. So that's events. And lastly is the chat function. So the chat can be used for one-on-one or group chats as well. So we can see here, again, you can send mobile and email notifications. And this one here is just a one-on-one conversation with Courtney and Global Health. You can attach some files, and notifications are sent quite regularly to let people know that there are new conversations going on here. From a patient engagement perspective, they're kind of the main features that HotHealth can help you with. The next point, so this is moving into the digitising of our practices. So digital forms, for me, this is probably one of the most exciting features. It's fairly new for us this year. We kind of fast-tracked the release of it around COVID-19. So digital forms are really important going into the future, because not only does it save administrative time from there's no longer, you don't need to print or store any documents anymore physically, or rescan them either. So those kind of three elements have been taken away. You're also reducing the risk of not being able to read someone's handwriting. And in addition to that, it is just easier for your patients as well. So I know recently I've been to quite a few cafes since COVID-19, and you've got to start taking details. I much prefer to go to ones that have that form available online, as opposed to me having to handwrite it out once I get there. The other thing about digital forms is that it allows you to have a better understanding of insights and analysis. So it's saving the data in a way that's structured. You can bulk export the data into a CSV or JSON format and then import that into whatever reporting software you use. So the forms don't have to be a clinical form. It can be anything from, new patient registrations, or patient satisfaction, patient recorded outcome measures. You could send those to patients between visits, or something like the COVID-19 screening form as well. Once someone completes the form, there's a few different ways you can get the data out of it. So you can either choose to have an email sent to your email address, or you can have it be sent via ReferralNet directly to a ReferralNet or Argus endpoint. So that really improves that workflow from patient receiving the form to them filling it out, and then that going back into your clinical system. If I have time, I'll show you that at the end. So once a patient has filled that out, as a manager of the site, I can see, I'll go back to that. So this is the back end. I can see the export functions up here, and then also all the form submissions that have been submitted. If the user is logged into HotHealth, you will see who that user was. And if it's green, it means someone within HotHealth as a manager has viewed that submission. You can also save that as a PDF or view it directly in the browser, the submission as well. From a form editing perspective, I'm just going to quickly touch on it. It's quite comprehensive. So you can send it to ReferralNet, or via ReferralNet, I should say. And then the rest of it is drag and drop. So you can really easily drag and drop fields in. There's advanced kind of layout, so we can have different columns. We can have content. So one way you could use the forms is for consent forms. So add content in, copy and paste all your terms into the content box. Add a checkbox that says, I've read the terms and conditions. They have to tick that. And then finally, we can also add a digital signing box as well. So that means that someone can actually digitally sign this with either their mouse cursor or their finger if they're on a phone or iPad or a touchscreen device. So that's the digital forms. We can add rules in as well. There's so much you can do with this forms. I'll probably get carried away if I keep going on it. So if you want to find out more about that, let me know. But I'm going to skip ahead to online booking. So online booking for HotHealth can either be used standalone or in conjunction at the moment with Mastercare Plus or Primary Clinic, which are two of Global Health's other products. But we are working with some other systems out there to integrate that with. So the book appointment process is really quite simple. It's as you would expect from other apps. I'll point out you can have filters, so speciality, services provided, and by location as well. So this person's available at 2 different locations. I'm going to pick that one. And then we can continue. You can see here as well, we have Stripe integration, so you can link online payments to a booking as well. So it's not linked to Medicare or anything like that. You'll still need another system to do all your claims. But if you want to take a deposit or a booking fee, or if you're a privately funded practice, you can actually take that payment at the time of booking. Likewise, we do have an online store component. So if you wanted to, you could create different items for sale in that and have people go online and purchase that item before they come in to visit you. So that's from a bookings perspective. Finally, the last thing in HotHealth that wanted to touch on today is video conferencing. So video conferencing in HotHealth is secure. It meets the Australian telehealth standards. And it allows you to conduct follow-up consults using video and offer after-hour services as well. It can cater for one-on-one bookings or also group bookings. So to access the video conferencing part, clients can either book themselves in to a teleconsulting appointment, like so, or if you don't want people booking in themselves for teleconsult appointments, you can just use the staff booking button here. Input your time, add the patient, add any other participants as required, and click create. At the time of the appointment, reminder emails will be sent to all the email addresses, including the staff member. They can all click on that link and it will take them to a page where they just click on join meeting and they have their meeting. It's mobile responsive. It can be accessed on any device. And we have, the list of browsers that are supported online. It's all the main ones, so Chrome, Safari, so on. Just briefly, I'll touch on client records, online client records, and also secure transfer of information. So in a lot of our conversations we've had recently with people working remotely and from home, having something on the cloud or even better, a native web-based solution is really important. And I often get asked if HotHealth does all the client management part, and it doesn't. It's just the engagement part. So I just thought I'd mention this in case that is something you're looking for. So this product, Mastercare Plus, integrates with HotHealth from a booking perspective. So we link up the appointment books and patients can book directly into your Mastercare Plus diary. As a provider, you can just work in Mastercare Plus and do the bookings in there. It also is linked from a forms perspective. So we link up, this form, it's a clinical form. So when it's submitted, we want that to go straight into the Mastercare Plus inbox. At the moment, we have packages for allied health, secure messaging, pharmacy, prescribing, referral management, and discharge summaries. So I'll just show you an example quickly. Just before I completed a COVID-19 form, and on that site I actually linked that to this instance of Mastercare Plus, our Allied Health Mastercare Plus demo. And we can see here that COVID screening form that I just filled in arrived in my inbox 5 minutes ago. It's pulled out of this form the client name and date of birth, and if I click on process, it's saying it can't find a patient match based in our record, and it's prompting me to add the client. If based on those details there was a client already in the system, it would prompt me to say, hey, is this the patient you want to save the form to? And it just saves as a PDF attached to the client file. So it's a really, completing that circle of digitization across the business. And the last point, I guess, comes back to this secure messaging as well. So we use ReferralNet to link HotHealth and Mastercare Plus, or HotHealth with any other clinical system. So it's just securely transferring information from one spot to another. It might be between clinical systems, so referrals or client notes. In this instance, it was from a client form to a ReferralNet inbox, and ReferralNet as well does link with Argus. So we've got quite broad coverage in terms of where that data can be sent to or exchanged between. Just got a couple of example workflows here. So really basic one, patient searches for health organisation online. They'll either end up at your website or the HotHealth site, depending on what your workflow is. They make that booking online. If it's an integrated system, that booking will be exchanged or synced with your PMS, practice management system. Then you can send the patient the link to the online form. This would be done in your existing processes. So if you send a two-way SMS reminder or a confirmation, you could actually add the link to the online form to that SMS. The patient would complete the form. The completed form would be sent back to your practice management system, and it can be attached to the patient for future records. No more scanning or storing of the paper file. The appointment occurs, whether that be in person or online. You can follow up with other forms, so non-clinical forms or forms that need to be done between visits. And then on top of that, if you're going to use HotHealth as that engagement type portal, the patient knows to visit that portal for additional information. It could be education or information about the clinic, or it could be to engage in a, patient provider relationship. So that's it for HotHealth. These are kind of the basic features of the HotHealth platform, but the benefits that it gives healthcare organisations is really wide, and depending on your organisation, you're going to see different benefits from it. So some small organisations that don't have a website, the biggest thing, or the easiest or most immediate thing they see out of it is that there is now a online touch point for them to send traffic to. For organisations that already have a website and they need more comprehensive website features that maybe not be in HotHealth, they get the benefits out of having a digital spot for online bookings and video consults, and now that digital forms as well is becoming an important part of their workflow. So that is me. Sorry, just run a little bit over our 15 minutes, but there is a lot to go through. So if you have any questions, please feel free to reply to my email. I will send this out in a link. Feel free to share it with team members if they were not able to make it today. And yeah, we're always happy to organise one-on-one demos as well. So if you have a specific question about how it might fit into your workflow, please feel free to let us know and we can help. And we'll see you next time. Thanks, everyone.